Hello, Coral Springs. I'm Lynn Martzel, the Director of Communications and Marketing, and I'm joined today by our Mayor, Scott Brook, City Manager Frank Babinick, and Deputy Chief Brad McKeon. We're committed to keeping our residents informed throughout this crisis. Today, we want to discuss emergency orders issued by Broward County and the City of Coral Springs. Broward County enacted Emergency Order 20-03, which urged shelter in place safer at home. In that order, municipalities were invited to regulate more strictly as they deemed best. It's important that our residents and businesses are clear about the requirements of the stay-at-home emergency order and why Coral Springs enacted further protective measures with Emergency Order 20-12, Safer at Home. Safer at Home requires residents to stay home and restricts the use of public rights of way within the parameters outlined in the order. Our goal is to further restrict the spread of COVID-19. I want to turn it over to our city manager, Frank Babinick. He's been working with city leaders all over Broward County who are enacting similar orders, and maybe he can talk a little bit more about how they've been working collaboratively.
It's our responsibility to make sure we're doing anything and everything we can to provide the highest level of protection to our communities. And that's why we issued the Safer at Home order. We've been working as a collective group throughout Broward County with Broward County administration and other cities throughout Broward County to try to come up with a comprehensive and cohesive order that would be consistent throughout Broward County. And you'll see a lot of cities have done this same order, as well as the county really putting the framework in place that led us to releasing this order. And the cities that haven't done it will soon be doing it as well. So this order really looks after the safety, health, and wellness of our community. And the only way that we're going to truly get ahead of this virus is by social distancing and really being vigilant in following the guidelines that are being put out by the medical professionals in making sure that we're paying attention to very good personal hygiene and cleaning requirements.
I was about to call you Chief Babinick. I apologize, our City Manager Babinick. I wanted you to talk to our residents a little bit more about what they can do within this order, because I want to make sure that people know what is authorized, and then also touch upon what we really are restricting.
Okay. Yeah, that's a good question. So think of it this way. Anything that you need for the necessities of life, you can do. So what does that mean? If you need to go seek medical attention, whether it's emergency or scheduled medical attention, you're allowed to go do that. If you have to go pick up medications from the pharmacy, you're allowed to go do that. So anything that's medical related, you can leave your home, leave your property, get in your car, use public transportation, however you normally would get there, you can go accomplish that. The other thing is food. If you need to go to the grocery store, you need to go to Costco or BJ's, Sam's, Walmart, Publix, whatever it is, whichever store you shop at for your groceries, you can go do that. What we have done within the order, for example, for all of the places I just mentioned, is we've put maintenance, sanitary, and other hygiene related requirements within the order that kind of leads the business to have to practice safe hygiene for the customers that are going to be visiting those areas. You can go to restaurants. Actually, we encourage you to please help support our local businesses, get delivery from restaurants and takeout. And I know we'll talk a little bit later about how we can safely do that. But please visit our restaurants. If you're the caregiver for somebody that that needs your help on a regular basis, you can go take care of that person. You can, if you normally shop for them or you normally cook for them. If they are vulnerable population, though, if there's somebody that has a compromised immune system, we ask you to make sure you're following proper hygiene and safety practices by wearing a mask and washing your hands and using hand sanitizer, keeping your distance from that person you would normally take care of, however you can and whenever practical. Also, we encourage people to get out and get exercise. This order is not meant to keep you in the four walls of your home. This order is meant to keep a household separated from other households. So if you're going to go out and get exercise, that's fine. And if you see other people walking or biking, just keep your distance. Keep that 6 to 10 foot distance when you're outside. We don't want to see, 4 or 5 households or actually, we don't even want to see 2 households getting together and getting in one big group and going for a walk. The point of the order is that whoever lives together should stay together, and we should keep separation from those that don't live together, so that way we're not contaminating each other. Please take your pets for a walk. They don't have to just stay on, within your little area. Obviously using a leash and all the safety practices you normally would, but we encourage those types of things. What you can't really do is you can't go visit a friend from your house to another house. Again, we want to make sure those households aren't mixing. You can't go to work unless you're one of the essential businesses that are outlined. And we have a whole list of those. And Lynn, I know your department has done a great job in publishing that. We don't want to have groups of people gathering together. Make sure that you are maintaining your 6 foot of distance. We can't really emphasize that enough. And unfortunately, right now, we have to protect the most vulnerable. And what that means is we can't go to, if you have a family member or a friend that's in an ALF or in a senior living facility or those types of things, we can't just go visit them. I know they may be lonely, and I know this is a very difficult time for them, but this is for their protection. They're very vulnerable. A lot of people are very vulnerable to this illness, especially those that are immunocompromised. And we want to make sure that we're looking out for them the best we can.
You hit the nail on the head right there about our vulnerable populations. We've always taken pride in caring for those who need us the most. And right now, that's just really good advice, Frank. I'm going to turn it over to Brad about a question that we're commonly getting. How are you enforcing the Safer at Home order?
Yeah, question. And I think the city manager, one of the things he said really highlights, this is about health, safety, and wellness. If we see people out, we may stop you, we may ask you what you're doing. You may not be aware of all the things in the order, which you can and can't do. So our first and foremost is really to educate people to gain compliance, because this is about everybody's safety, including yours and everybody that you could come into contact with. However, if you are out and about, there is the chance that we could take enforcement actions to include a second-degree misdemeanor, either an in-custody arrest or notice to appear. Obviously, we're hoping that we never get to that point. We're hoping that it's more about education and compliance, but understand that it is technically a violation of Florida state statute.
The secondary question to that, we've been getting this question probably every live Facebook event we've had, is what about a curfew? Are you considering a curfew? Why has Coral Springs not issued a curfew? Can you speak to that a little bit more?
So I know that other cities, other locations have done curfews. I know that we've had a discussion about them. It's been an idea that's been put on the table and evaluated. But I think, again, when you really look at a curfew, is just very strict in the sense of time. It doesn't really give people direction on what they can and can't do. I think that this, Safer at Home order actually kind of it inherently puts a time restriction, because things shouldn't be open. You shouldn't be doing certain things, but it actually gives you more direction on how you can not only be safer, but the things that you can do and that you can't do, as opposed to just saying there's a strict time to it. So I think that this is probably more effective at this time, educating, giving people information other than just saying it's strictly, this time to this time.
I have to agree, because essential business for the most part closes at a certain time. Grocery stores and pharmacies and the like all close at those times. Mayor, at this time, I'm going to turn it over to you. One of your common sayings is unity in the community. And unfortunately, now our unity in the community is at a 6-foot different distance. But what advice do you have to offer to our residents how they could be helping one another out during this crisis?
Two pieces of advice that I would share with you all. One is to share kindness, spread love, don't spread germs. If you can, stay at home. Stay at home. Stay at home with your family as much as you can. And I would also ask you all, people are responding to the crisis in different ways and at different times. Have everybody follow our laws, including visitors from other cities. And, you can share a text. I've been FaceTiming with my family almost every night. You can FaceTime 4, 5, or 6 people at a time. Tonight, we're going to do house party. So there are ways to still be engaged and still be connected with one another and still maintain that social distance. And I would also just ask you all, as much as you can, to support our local businesses, support the restaurants that are serving. I've been getting takeout recently from La Fontana, Metro Diner, different places, and it's a way to have something that I enjoy and at the same time support a local business. So those are the few pieces of advice that I would share with everybody. And main thing is to, stay safe, stay calm, and I'd also urge them to stay positive.
Positivity is something we need right now more than ever. One thing we just learned is the mayor is going to be hosting a remote house party. So, and to add to that, Mayor, and we've addressed this before, but I thought it is worth addressing again as it relates to common supplies. A lot of people feel the need to go out and overbuy. Can you talk about that, why they shouldn't really go out and overbuy on certain products like toilet paper and other necessities that other people really do need?
There's no need to overstock anything, whether it's water, toilet paper, paper towels. It's just unnecessary. There's plenty of supplies. And we would just ask you to just take what you need for the next week, maybe. You don't need to hoard for a month. We're not expecting a hurricane. We're not expecting loss of electricity or loss of water. And I think maybe too many people have thought that this is similar to a hurricane and we're going to be locked in and you can't get out. But we're urging you, yes, if you need something at the supermarket, you can go get it. But you don't need to hoard toilet paper. There's no need for that.
Certainly you can do it, and you can do it at a safe distance. And, the one word we keep using is unprecedented. And this is an unprecedented. This is not like a hurricane. And we live in South Florida and have experienced that on several occasions. So the things that are taking place are new and changing every day. And I know from a communication standpoint, we're updating constantly because when we have information ready to go out, something else is now changed once again. So thank you for that, Mayor. That was important information. And Frank, I did want to talk about our parks. A lot of questions about the parks. The parks are closed, but then you did talk about recreation. So if someone wanted to go for a walk or, can you just talk about that a little bit?
So as it relates to the parks are closed. The reason we closed the parks was, again, to provide that social distancing and making sure that we weren't having gatherings. So the parks buildings are closed, the fields are closed, and those, the basketball courts, the playgrounds, and those are closed, again, for sanitary reasons, to make sure we don't have, people climbing all over a piece of equipment in a playground, and then somebody else goes on there and climbs on it right afterwards. If you use a park in a passive manner, meaning it has a walkway, and you're using it simply to go for a walk or a jog, that's not a problem. However, please do not remove the barricades. Please do not remove the cones. Please do not remove any fire line or emergency tape that might be there closing off certain areas. Please don't jump the fences and go on the fields. and those types of things, because at that point you'd be seeing Deputy Chief McKeon and his folks coming out and having a conversation with you. We want to allow folks to use the parks in a passive manner, meaning to get a little bit of exercise, but the fields at this point are closed, and really they're closed because we can't have close contact with those outside of our household to make sure we're practicing everything we can to prevent from spreading this very dangerous virus.
Very, very good advice, and we commend our park staff who have been disinfecting equipment, and they've been out there because there's still jobs that they have to accomplish as well. So they've been doing a really phenomenal job, and we really appreciate their service as well. With this order, when do you expect that we'd be able to lift the order, Frank?
So you mentioned a word before, and we are in truly in an unprecedented time. There's not a lot of information that's known about the virus. We're getting we're getting new information on a daily basis, and we're getting updated by our medical professionals, and we're going off of what they're providing us. So at this point, we really cannot tell you when the order will be lifted. The indicators that we're looking at is the health of our community. So as we control and stop the spread of this dangerous virus, that's when we'll start to get an indicator as to when we could start working on reopening businesses, providing full access back to the residents, and getting things back to normal the best we can. And really, we are monitoring this on a regular basis. We get new information constantly throughout the day. Our staff is working throughout the weekends to make sure that we're staying up to date on the latest information that's available.
So I do have a question here from Shelley, who helps a family member in Palm Beach. She's asking, can she go and come home in the evening, and is there a specific time that she needs to be back home here in the city of Coral Springs?
Brad, you want to take that?
Yeah, Brad, I'm sorry. I should have indicated, but Brad, if you could help me out with that one.
And I think we've mentioned that, but it's worth clarifying that, again, that is one of the things that you are permitted to do. You are allowed to take care of your family members. I would just advise that you check with where your family member lives to make sure that they don't have any other type of restrictions or an actual curfew in place. But I got to believe that they also will have some type of exemption for taking care of a family member. So again, you're good under this order to take care of that family member, but just check to wherever you have to go to make sure that they don't have any other restrictions.
So one of the terms we've been hesitant to use because it's not true, and I'm getting this from Sandra Murray, asking, are we going to have a lockdown? And I know you already addressed the curfew issue. Can you explain that, Brad, again, that this is not a lockdown? People are free to move about as needed.
Right. And again, it goes back to, there are some things that we know people still are going to have to do. They still have to go. You have to get food. You have to get medications. You have to take care of loved ones. So again, having a full lockdown at this point, I think just adds maybe another layer to the problem for some of these people. What we're asking you to do is to do it safely, to respect, the order itself. Listen to what those habits are that people are reinforcing. Good personal hygiene habits, social distancing, washing your hands, all those things that, again, will prevent you when you are out there from hopefully coming in contact or being sick.
And Frank, I have this one from Carol asking about houses of worship. We are indeed allowed to travel to and from houses of worship, correct?
That is correct, Lynn. So as far as houses of worship go, we do cover them in our order. And what we're asking our houses of worship to do is cut down their capacity to allow for proper spacing between anybody who may be going to a house of worship. We're asking them to have, again, the proper hygiene products and sanitary processes in place to make sure that everybody is safe. But houses of worship are still, you're still a permitted use. It is under certain circumstances. Again, we're just asking them to watch their capacities and making sure everybody is separated by at least that 6 foot difference. Now, if you and your family go to a house of worship, you live with the folks in your household, you can sit together. because you're already together. You arrive together. You're in the same car together. That's fine. But if you and your neighbor are going, we require the separate households to be separated by the 6 foot difference.
Yeah, we received a lot of questions today about houses of worship because, you see the rule about, 10 or less and no gathering. But again, we're asking people to be smart and really just to stay separated and to remain healthy. Unprecedented when you know that the Archdiocese has closed churches here in Broward and Miami. So it's like I said, unprecedented. I have another one. I'm gonna have you address this, Brad. Costco is packed. Target is packed. Walmart is packed. These are essential businesses, but people are going out like it's a day trip. What can be done to stop people from going out unnecessarily? And I'll add to that. What are we doing from a law enforcement perspective to educate the businesses, to educate the residents, and are we doing any type of security out at those establishments?
Right. So I guess the first part of the question, limiting people out there, I guess all we can really do is ask the residents, ask our community to, again, review this order and understand that it really should only be for essential needs. If you need something, by all means, please go get what you need, but try not to purchase things excessively or just go out shopping to get out of the house. Go for a walk, go do some exercise, do some other things, but try and limit the places that are open from visiting those and increase in the numbers. Because to the second part of that question, what are other businesses doing? Is Costco. I happened to go there to get some stuff over the weekend, and they've actually done a phenomenal job of, they put tape on the ground, keeping people 6 feet apart. They're wiping down the carts as you walk in. You're not allowed to grab a cart without an employee handing it to you because they want to make sure that it's been sanitized. They really are going, I think, above and beyond and setting the example for what a lot of companies could mirror if there's anybody out there who kind of wonders what maybe could be done. Home Depot is another great example of that. They're limiting the number of people into the store. As far as from the police department angle, we are trying to staff and have people have a presence at all of these locations as much as we can because, again, these are unprecedented times as we've talked about it. We know that some people, they are desperate to get some items, that tensions, can rise. Plus, we want to be there also as a resource for people to know that, hey, this is what you can and can't do, for the stores, for what they can and can't do. So again, we're all in this together. It's, again, education, public safety, and health. That really is our focus.
Lynn, if I can add one thing to that, please.
Sure, absolutely.
So, Lynn, the other thing to keep in mind with that too, the order does cover big box stores. So any stores that are like your grocery stores or your Costco's, the order limits them to 25% capacity. What that means is whenever a store is open, there's a number that is assigned to that store of how many people can be in that building at one time. So what we've done is we've taken that and reduced that from 100% to 25%. When you have a 40,000 square foot store, only letting 10 people in really doesn't make sense. So we're going by capacity rather than number. When you have a 250 square foot room, then 10 people is a lot. So that's why we use that methodology to allow for the occupancy, because there's already a built-in number, and that number is different depending on what size the store is.
And so, Lynn, I have two more things to add about that.
Sure.
One suggestion is, be or find a designated shopper. And also, don't just go out for 2 items. Maybe go out when you need 7 or 10. Be smart about your shopping. Third, actually, is order online. So I know some neighbors, and my daughter constantly order online at Publix. So those are a few ways to not spread the virus.
And Lynn, if I could jump in, because I think there's probably another question that has come up or will come up here, as far as even businesses that are open, that are essential or non-essential. I know one of the things we're trying to do really, work on really hard here with our code compliance is to go out and visit these locations and give them information in advance, because they may not be aware of all these practices that we're talking about, the limiting the capacity, the 6 feet, the cleaning of the shopping carts. In addition to that, people may see a business that's open. We also want to know about those. We want you to call our dispatch. We want to go out there. We want to make contact with them to make sure that they understand if they can or can't be open. So please call our non-emergency number if you see something that you don't think should be open. Maybe they have an exemption for some reason, or maybe they don't, and they're just not aware of it. But if you call us, we'll go out there, we'll take care of it, and we'll educate them.
And that number, by the way, is 954-344-1800. That is our non-emergency number. Please do not use 911 to report businesses that you believe should not be open. And I wanted to get back to the religious, about religious organizations. That applied to those as well, based on occupancy. If you're able to watch your religious services online or remotely, we really encourage you to do so. Our next question is from Celine Bedard. She's asking about, should ER nurses be going back home after shift? And Frank, I'm going to have you talk about that, and then I'll turn it over to the mayor to really talk about our medical personnel and how valuable they are.
So Lynn, there's a lot of conversation around this right now with ER docs, nurses, first responders, police officers, firefighters, paramedics. And what I know we're doing as a city for our first responders, and I know some of our local hospitals are either talking about it or doing it, is putting in decon procedures for these folks prior to leaving work and then going home. When you look at the amount of exposure they have, they are at risk. And if they're living with somebody that is of, one of those that should be protected, then they need to make that decision, for themselves. But for example, wearing a mask when you're at home, you may need to do that. You may need to isolate yourself in your own home, meaning when you get home from work, you might have a room that's just yours with a bathroom that if you're able to go in there and not really mix with the rest of the household. I've had multiple conversations with Dr. Intevi about this, who's our medical director, and you can actually see him on Monday at 4:00. He's going to be doing a Facebook Live. But that would probably be a good question for him from his perspective. But I know that in kind of a perfect world, we really wouldn't be mixing those that had high levels of exposures with those that didn't. But they need somewhere to be able to go home and sleep. But the best practice is to protect themselves while they're on duty, decon before they go home, and then protect themselves while they're at home.
And Mayor, I want to turn it over to you about our medical community. I know you have very strong feelings about not only our medical community, but our first responders.
Absolutely. Our first responders are second to none in the nation. All the men and women care so much. They put themselves at risk every day, and maybe now more in these times than ever before. Thankfully, we have the personal protective equipment for them that they need. And our hospital community here at Coral Springs has also been just so collaborative, so kind, so professional, and also very proactive. They've been in touch with us and us with them, and all of us with the community to keep everybody informed. And one of the things that I keep thinking in my head is this vision that we've seen on Facebook with all these medical professionals where it says, support your medical professionals and stay home. And I would just, on that note, I'd give caution to everybody to think about what you're doing and choosing not to do with your time. Hopefully more of those choices are at home, because you don't want to regret, where we might be in 3 or 4 weeks. I wish I hadn't been there. I wish I hadn't made contact with that person because who knows what. And it's a very safe measure to follow, or safer at home order. And if you're thinking you're doing it just for yourself, you're not. You're doing it for our whole community. It would be great if in 3 weeks the numbers, barely went up. But it really takes unity in our community to do that. And like I said, if nothing else, think about our medical professionals and our first responders and what they're doing to keep all of us safe. And a great way to thank them is to stay home as much as you can.
I couldn't agree more, Mayor. And we launched a campaign, Who Are You Staying Home For? Giving everybody the why we enacted Safer at Home, because you have to stay home for these people so we can keep everyone safe. And I think that was such a great point. I'm going to turn this one over to you, Brad, about the corner stores being open. So I'm assuming Darcy, who made this comment, is thinking about convenience stores. Can you speak about that a little bit?
So, and I don't know if it's, I'm looking, I have the order in front of me here. I want to make sure I get the verbiage correctly if I can. And, City Manager Babinek, if you know the exact verbiage, feel free to jump in.
Yeah,
but
I can help you with that. So basically, Any store that sells groceries or is a supplier of food products is allowed to stay open. So if their primary business is to sell food products, they can stay open.
Very, very good. A lot of people.
I'm sorry, Lynn.
Sure.
Just to keep in mind too, some people don't have transportation, and they may rely on those corner stores or convenience stores for their necessities, milk, eggs, bread, those types of things. But those stores still need to practice the same level of protection as all the other stores. 25% capacity, making sure that they're sanitizing and wiping down the common areas, providing for hand sanitizer within the store. So they still need to protect their customers the same way a larger store would need to.
So we're getting a lot of questions on enforcement, and we did really cover that in the beginning. I do want to ask this question by Jolie. There really haven't been any guidelines for small private schools as public schools are closed. What about teachers that want to go into their room to conduct distance learning when they're alone, and if there's less than 3 people? And then, and I'm going to turn this over to you, Frank, and if you could talk a little bit about the order that you put in place for the city related to daycare and why daycare is just so important right now.
So the private schools are basically under the same guidelines as our daycare facilities. What does that mean? It means 10 people or less in a classroom. The classrooms cannot intermingle, so they have to be separated. They can't go have recess together. They can't go eat in a common area together. You have to practice certain hygiene requirements, such as hand washing stations and hand sanitizer. The classrooms need to be cleaned on a regular basis. Any child or teacher or employee that is exhibiting any signs of or symptoms of COVID-19 cannot enter the building. Coughing, sneezing, a temperature greater than 99.9, body aches, loss of taste or smell. You can go on the CDC's website or our website, and there's links to what all of those signs and symptoms are. Also, there's a requirement that anybody who works in any of those facilities are checked before going into the facility. There's a questionnaire that basically you ask if you have any signs and symptoms. They are to have their temperature taken, and if they pass all of that, then they can go in and perform their duties or tasks as a teacher. So if you have a small private school, you fall under those same guidelines and requirements.
Very good explanation. I do want to just touch upon this again, Brad, if you don't mind. Just explain why we haven't enacted a curfew. We have people demanding they want a shelter-in-place order, and I think this is as close as we can get by enacting these more restrictions to limit people going outside and gathering. But can you just once again just explain the curfew?
Well, again, and look, we've had a curfew under different situations. I think back to some of the hurricanes. I know we had them, and we still had people that were out and about because they don't spell out what you can or can't do. Again, I think we've kind of done it in a much more effective manner, that we're telling you what you can do, what you can't do. The things that you can do shouldn't be open late at night. You shouldn't be out unless you have to provide, again, the medical care for somebody. It's an emergency type situation. So, I mean, in a roundabout way, we have a curfew in a sense, but it's done with specific direction and a specific order, as opposed to, again, just giving you a time with no direction. So I think, again, this is much more effective at this time to give people clear direction as opposed to just a restriction of a time.
Len, on top of that, working with the city managers throughout Broward County, there is discussion of putting a curfew in place. And basically, we would want, if we did put a curfew in place just as an additional measure, we would want that to be countywide. You don't want to drive from one city to another. One city has a 7 o'clock curfew, another city has a 10 o'clock curfew. The inconsistency just adds to public confusion.
Our leaders during this emergency are your city manager, Frank Babinek, who has amazing experience in public health, and Alex Falcone, who's our emergency manager, and they are doing an excellent job. They're working more hours than you can imagine, and they're doing so in a calm fashion, as well as other leaders in our city. And those of you that are encouragers, that are sharing information and not scaring others, we urge you to continue to do that. One of the reasons that I think we are as safe as we are is because of the collaboration and cooperation with the community, with our government. So you're in great hands. These are unprecedented times, and we would just urge you to stay united, stay together, 6 feet apart, and stay at home if you can, and leverage your resources in a way where you can be intelligent about shopping and about going out so that you don't have to go out that much. I know it's a tough time. You want to get out. You want to, have some more space, and just try to use the space right around you in your immediate neighborhood if you can. Use technology if you can. Start binging some shows that maybe you might find enjoyable, and you can be connected without having to be within 6 feet of somebody else. So I really appreciate all of the work of our city, my colleagues on the commission. You guys are fantastic, and Lynn, you're doing a great job getting out messaging and being consistent and being clear. So thank you all very much.
Lynn, you've been asking questions this whole time. Can I ask you one? Can you tell our residents where they can find all of those numbers and all of that information that you just provided? Can you tell them where they can get all that information in one spot?
Absolutely. www.coralsprings.org. Our website is in emergency mode, really dedicated to COVID-19, and we are providing updates daily. So that is a great resource for our residents, and I appreciate you asking. I appreciate your leadership, Frank. I appreciate your leadership, Mayor, and of course, our police department, Chief Perry and Chief McKeon and the rest of their team, and Chief McNally over in the fire department. Thank you so much, and we will see you again on Monday at 4 o'clock for our live with Dr. Anteffi. Have a great night, Coral Springs.
Good night.